After the thyroid gland has been removed, two things you want to watch out for. Number one, low calcium levels. We call that hypocalcemia, low calcium level. And number two, laryngeal nerve damage. I'm going to show you a picture of the laryngeal nerve. Then that's when you will understand why, if a client has had surgery, there's a likelihood that if care is not taken, they can cause laryngeal nerve damage. So let's talk about hypocalcemia. Hypocalcemia. Okay, so hypocalcemia, you realize that if the patient has had surgery for the thyroid gland, and then after that you realize that, oh, the patient is complaining of numbness in the hands, in the toes, then start thinking about hypocalcemia. Number two, if the client starts talking about numbness around the lips, then you're thinking about hypocalcemia. If you realize that the patient's muscles are twitching, what is happening? Hypocalcemia. And then you realize that this is what we call the Chivostek sign. So this patient has had thyroid surgery. You can see the mark there. And then when they hit the face, it twitches a little bit. And then we also have the Trousseau sign, where you can put a blood pressure cuff on the hand. You inflate the blood pressure cuff, you realize that the hand will start twitching like that. So you have to know that after thyroid surgery, okay, the parathyroid glands, these glands, they can be removed as well, unconsciously. And these things can happen. So when you see a patient with tingling toes, tingling face, twitching, when you try to check the blood pressure, and then numbness around the lips, what you should be requesting for will be serum calcium levels. You should be requesting for that. Now, the other complication you want to be very careful about is what we call the laryngeal nerve damage. And how do you tell that this patient has laryngeal nerve damage? If after the thyroid surgery, the patient can't speak loudly, then you can tell that, oh no, then this patient's laryngeal nerve has been affected. And if the quality of the tone of the voice is affected, then you may think that, okay, there was some laryngeal nerve damage as well there. Okay, so laryngeal nerve damage, hypocalcemia, two complications after thyroid surgery that you need to know.